wearing a mask will be mandatory in public transports starting July the 13th.
The province will make masks mandatory. Mandatory face mask bylaws
Masks
are now
will be
in effect
mandatory
here
in all closed public
You
places.
must now wear a mask or face covering in any indoor area.
New face mask rules do come into effect in England this morning.
Masks have recently become an essential everyday object, but they aren't new to our lives. Whether it's in hospitals or on the ground, they are everywhere now. We've seen this problem before with plastic water bottles. Before, using plastic water bottles was the norm. They took over our oceans and landfills when it was too late. We as a society can avoid repeating our past mistakes by realizing masks will have a similar impact on the environment. Canada has a population of over 37 million. At least 37 million masks are worn daily and thrown away daily. This is a serious issue. The Workplace Health and Safety Commission specifically asks workers who cannot keep a 2-meter distance to wear a surgical mask. This means every employee must wear a disposable mask at work, thus disposing of it at the end of their shift.
I wear a disposable mask only one time a week for my shift at the restaurant. It's mandatory to wear a disposable mask in a restaurant place or bar because of the COVID-19.
Dr. Thomas Schlick, who teaches the history of modern medicine at McGill University, explains the shocking origins of the disposable surgical mask.
The first surgical mask for the first decades was just made of gauze, of dressing material, so it was reusable. And the switch to disposable material happened in the 1960s, early 70s. And that was in the context of a whole tendency everywhere to use disposable materials. Just think of McDonald's, or even in restaurants.
Usable ones I don't like because I feel they're thicker, they don't feel as safe, and it's also because I change my disposable mask every couple of hours just because for hygiene purposes, whereas a reusable one I don't change if I wear it.
Judging from history, I could very well imagine that we can go back to reusable materials in mask production, at least for particular purposes. For example, for masks for the whole population.
Like, I don't know about the cloth masks, like how efficient they are. This I know is efficient, but with the cloth masks, like you have to have a certain percentage of like thread by counts in your fabric so that the particles don't go out or in. So yeah, that's why.
So we might have to distinguish between the masks that are used for surgery and the masks that are used in epidemic situations by the whole population. In surgery, the requirements for the sterility of the mask are higher, so maybe it will be much harder to go to reusable masks there. It came mainly actually from the manufacturers of the disposable material who suggested using these throwaway materials instead of reusable materials.
I think that these are designed for keeping your germs to yourself. And I think that it's just better to dispose of it instead of washing it, touching it with your hands and everything. So I'd rather just wear one that's made for germs, and like that way my germs don't exit the mask. I don't know if that makes sense.
The pandemic has brought a wave of new mask businesses. Sean Talsi is among those who started getting involved to fight the virus, launching his company, Bien-Ali. Bien-Ali has been producing reusable masks since April, looking to reduce the negative effects disposable ones have on the environment.
I was laid off from work for a 3-week period in March 2020, so really at the beginning of the pandemic. And during that layoff that I had, I started reading a lot on COVID-19. My girlfriend, which is a doctor, she was super busy. I was at home by myself. And I read on COVID-19 and I tried to understand why I was in this situation. I have an engineering degree, a law degree, couldn't find a job. It didn't make any sense to me. So I started reading on COVID-19 and I realized that we were about 3 weeks behind from the Asian countries in the spread of the disease. Knowing that, I started reading on the news in Asia, so Taiwan, Singapore, and reading those newspapers, I realized that the mask was going to be a big thing here in North America in about 3 weeks. And that's how I got the idea of starting this company.
Todd says reusable masks do more than help the environment. They also help to create jobs for the community.
We have about 20 different employees that work for us at different times. And the seamstresses, there's at least 15 other seamstresses that work out of contracts. We also have people that are building poly mailers for us, so they have another 5 employees at their shop. We've got people that are making cardboard boxes for us as well, cartons that we put in the poly mailers. So overall, all the jobs that the Bien Ali brand has generated, I would say it's at least over 50.
Talsey started his company in a 500 square feet apartment with 3 other friends who had no prior experience in retail. He then moved to his current location, receiving more than 200 orders per day. Bien Ali calculated that one reusable mask is equivalent to 160 disposable masks.
If everybody would wear a reusable mask and clean them and then get another one after that instead of always using disposable masks, the impact on the environment would be huge. That means there would be a lot less disposable masks on the street, like we see a lot in Montreal, which is very sad, and we would have a lot less in our garbages and our disposable sites.
Completely eliminating a mask that is part of the essential equipment of our healthcare workers is basically impossible, but another mask can't be removed from our lives.
The big player beside the N95 is the surgical mask. So the 3-fold surgical mask, the blue mask that people buy and that they wear and then dispose of it. And that's where we think that the Bien Ali mask can become an alternative to these masks.
How many times have you left your house and forgot your masks, so you had to go buy a pack of disposable masks at the pharmacy? Bien Ali wants people to be more wary of their impact on the environment.
I'm hoping that something's going to come out because there's no reason why in 1960 we were able to use reusable masks, and now in 2020 where technology is even better than what it was back then, we wouldn't be able to use reusable masks. I really think it's a change of mindset more than a change of technology.
I prefer them to the disposable ones. Like I wear the disposable ones when I have to if I don't have one of my regular ones with me, but they tend to be more comfortable. And the blue ones I find can get kind of grimy looking. Like I don't know if you've ever seen someone that have like coffee stains on them. It's kind of off-putting.
I really feel that it's a certain pressure that's being given from probably different companies that want to keep the monopoly around the disposable mask just because it's been like that for maybe 60 years and they want it to stay that way.
Here we have to wear the disposable ones and change it every 4 hours.
The testing is not the issue. The testing, we can get our product tested and conform. The thing is there's no test that's available for reusable masks at the moment. We're trying to find a way for us to get into this field of clinical or health products, which is very difficult because of Santé Canada that doesn't allow us to sell reusable masks to people in the health field.
Bien Ali hasn't been able to get into contact with the government. On the other hand, the non-profit organization FP Innovations was approached by the government late August to produce a Canadian-made surgical mask due to a PPE shortage in hospitals. The company then researched how to make the mask more eco-friendly. They figured out how to make the middle layer of the surgical mask plant-based. They are currently working on a 100% biodegradable mask, estimated to release January 2021.
The funding that goes with the first phase was $1.3 million, and the second phase is going to be at least as substantial. We had a solution to ease the pandemic and be useful for Canada, but definitely our Canadian government sees the benefit of sustainable material, and they showed their interest in that second phase. So I don't know if we've completely learn from what has happened in the past.
When you throw them away all the time, it's not good for the environment. So of course, like when you use the reusable ones, it's better for the environment.
And as we are making our tests validated externally, we see that the performance, it's actually better than we thought. And we are thinking that we may be able to achieve surgical mask level. We're not that far.
I work in a CHSLD, so I have to work with a mask on every day. So basically, it hasn't changed my life.
Well, I definitely think that the masks are there with us for a long period of time. They have been there before the pandemic, and they will remain. In Canada, we were lucky enough not to have to wear those masks on a daily basis in normal situation. But you already use those masks when you go to your doctor appointment. If you're feeling some flu symptoms, they ask you to wear a mask. So.
Now, months after masks are mandatory, we're finally discussing the issue of reusable masks during a press conference. A journalist asked Dr. Horacio Arruda if they'll recommend Quebecers to wear a non-medical 3-layer surgical mask with an air filter, as suggested by Canada's Chief Public Health Officer, Dr. Theresa Tam.
On sait que les couvre-visages n'ont pas tous le même niveau d'efficacité, que notamment le nombre d'épaisseurs supplémentaires va être un filtrant supplémentaire, ce qui va par contre être des fois plus difficile à respirer, mais je pense qu'on ne peut pas être contre cet élément-là. Je veux juste vous dire qu'on a fait effectuer des travaux par contre avec l'IRSST actuellement qui va nous revenir avec certains standards de couvre-visage qui pourraient des fois atteindre quasiment le masque médical. Mais on est en train de travailler ça avec l'IRSST, notamment aussi pour fournir aux entreprises certains standards, ceux qui en fabriquent, là, pour permettre de le faire. Mais je pense que les recommandations de Dr. Tam ne peuvent pas nuire.
The pandemic is a reason why we're talking about masks. If there wouldn't be any pandemic, we wouldn't even thought about talking about disposable masks because it wouldn't have been a thing. Now that the masks are out there and everybody's wearing them, it is a reason for it to happen now. And also the fact that us, as when I go shopping at the mall, I can wear a reusable mask, but the secretary that's in the clinic, she has to wear a surgical mask, but she probably has the same contact with people that I have when I go shopping. It doesn't make any sense. So the government at the moment has set a double standard for the general population and for the health sector, where there's no really logic in what they're doing. I find it's really cool that young people like you are using this subject as a subject for their work at school, and it's definitely something that has to be done. So congratulations on that.